We are going to start about the cardiology. As we know, in heart we have four chamber. You can see in image. Okay, so we will start from the heart anatomy. Okay, so you can see like we have like two atria, two ventricle. Okay, so between we have like two side of the heart, right right side and left side. Okay, so in right side of the heart, okay, so between atria and ventricular we have tricuspid valve. Okay, between left atria and left ventricle we have bicuspid valve. Okay, so why we are starting from this anatomy? So this is very basic. Okay, if you know the basic anatomy, okay, so you can understand the physiology function very well. That's why I will teach you first like basic anatomy, then we will move the physiology and etc etc. Okay, so this is very basic thing. So okay, so between atria and atria we have interatrial septum. Okay, between ventricle and ventricle inter we have interventricular septum. Okay, and we have three layer of the heart. Okay, uh, which which layer that was the most inside? It is endocardium. Okay, myocardium is the middle one and pericardium. Okay, which it is the layer which layer like layer of the heart who cover the heart. Okay, so pericardial, so we have the in between pericardial. Okay, in pericardial, so we have interventricular septum. No, not inter pericardial. Okay, between pericardium we have the we have the fluid. Okay, so it this fluid, this green which I mark, it is the pericardial fluid. Okay, then we will move. We have like in right side tricuspid valve, left side bicuspid or mitral valve. Okay, so this is the very basic. Okay, so as I told, we have two. Okay, atria is the thin wall and ventricle is the thick wall. Why atria is the thin wall and why ventricle is the thick wall? Okay, so I will explain the answer of this question in when I will start the systemic and pulmonic circulation. Okay, so I will tell you the basic because like you know like in right ventricle and in right side of the heart. Okay, there is like only the thing is like they are not circulating blood in the body, so the force in like a right atrium right side of the heart, it's very low. Okay, but if I will talk about the left side of the heart, so like from the aorta it will like circulate whole body, so we want like high pressure. Okay, so from ventricle to aorta, so like from left side of the ventricle to the aorta, it will like blood will goes like very high pressure. Okay, so that's why there is like because of the high pressure there are like if you there is like one clinical significant. Okay, so the left side of the heart like wall is thick than the right side. So if you want to identify the which is the right side, which is the left side, so you have to see like which the thickness of the wall. If the thickness of the wall is more very normal, this is very physiological, this is not abnormal condition. So okay, physiologically the left side of the heart wall is the thick and right side of the heart is not as much thick. Okay, so this is